Almost on a daily basis, I'm in a discussion with patients about, should I get a breast lift with my breast augmentation, or should I get breast augmentation alone? And there are ways to make this decision. And I've found ways that I can be very helpful so we can head in the right direction. The decision's already been made to do the breast augmentation, but how do you make the decision whether you should do the lift? Well, on exam, we look at where the nipple is in relation to the fold. If the nipple is at or above the fold, it's very reasonable and likely she will be happy with breast augmentation alone, with the occasional exception of women who have breast tissue hanging below the fold as well. If the breast tissue hanging below the fold bothers her, if that's the thing that bothers her the most, then maybe at that point, even if the nipple is at the fold or above, we should consider doing a full type of lift. But overall, when the nipple is at or below the fold, we will go with breast augmentation alone, and most of the time that works out long term. Now let's say a woman has a little more degree of sag. Now when we say degree of sag, it could be in two different ways. The nipple level is lower. The nipple level is below the level of the inframammary fold, of the fold beneath the breast. The other type of sag we look at is, where is the breast tissue hanging? If there's more than just a little bit of breast tissue hanging below the fold and this is bothersome to her, then we start thinking more seriously about doing a lift with the implants. Of course you can do a lift alone, but these are women that want breast implants and they're wondering if they should get a lift at the same time. Well, there are basically two general patterns of lifts. One, it tends to be more attractive to women, and of course we all want less scar, is the scar limited to right around the areola, just around the areola. It could be mostly around the areola or all the way around. What most women don't realize though is, yes, this helps the level of the nipple, it slides the nipple up, but it has no ability to help the breast tissue hanging below the fold, and overall the breast shape is actually a little worse because the purse string or the Benelli, the different names for this scar limited to around the areola, it has a flattening effect. It actually can't even be done without an implant because the implant has to balance out the flattening by pushing back out. So anyway, that is the first type of breast lift that can be done. That needs to be considered, but most of the time there is more sag that the woman's concerned about. And if you push the indications for the scar limited around the areola, you're probably going to have too much trade-off of flattening and just an undesirable shape. So for all issues of sag, nipple level and breast tissue hanging below the fold, the more full lift, which is scar around the areola, vertical and some in the fold as well, is going to be much more effective. It's going to correct all of the issues of shape. I feel strongly though, when this type of lift is done, it should be almost always a vertical type of lift where there's a vertical wedge excision of breast tissue taken, and that gives the most effective long-term results with the lift. So the nipple is moved up, the scar is going to be much better than the type of lifts with the scar around the areola because the tension is not centered around the areola. And the breast tissue hanging below the fold is dramatically and effectively lifted with this type of lift. So those are the main choices of types of lift with an implant at the same time. If one isn't going to be doing a vertical wedge lift, the type of full lift that I'm talking about, then it's going to be the older version of a full lift, which is a skin lift. That has a longer scar completely across underneath, and unfortunately the lift is worse. So there's more scar and the lift is not as good. So I think a woman needs to be educated and ask, are you taking a wedge of actual breast tissue hanging for a vertical wedge excision or a vertical lift, or is this the old type of lift? They both have the vertical scar, but the results are much different. So hopefully that's been helpful.